So what brings you to the bed today? So it's only been 5 months for you.
Mm-hmm.
Do you feel different now than you did like a month into being positive?
Yes. So I think, and you probably know this, it gets easier. Once we educate ourselves, we have the tools to like navigate these things, right? But like not everyone does that because, well, especially like my friends, they're straight, so like I don't think they can think that they're gonna go through something like that. How do you feel after all these years? Is it get better?
It absolutely does get better, and I do believe that my opinions have changed a lot when it comes to HIV for sure.
My mother, who is a nurse, practicing nurse in Canada, when I told her that I was HIV positive, she asked me how long I have to live.
Oh my God.
I was just like, you need to go do some research and I will come back to you. I was in a relationship. We'd been trying to get on PrEP, but weren't successful. He then told me that he tested positive. So I went into the clinic and showed up at 9 a.m. when they opened, when I was told to be there. No one was there. When the doctor finally came in, she like yelled down the corridor of the clinic, "Hey, can I get the HIV paperwork for this client?" And she was like, "You're positive." I then asked her if she can give me any recommendations or if she knows of an HIV specialist. She says no. And then I say, well, how do I go about finding an HIV specialist? She Googles. She pulls up her phone and she Googles. She writes down the first 3 numbers, hands them to me on a piece of paper, and says, "Do you have anything else?" And I was like, "No, you have been more harmful than good. I'm gonna leave. Please educate yourself and be better, because I am someone who knows about HIV. If I was someone who didn't know about HIV, God knows what would happen if I went out into the world after this encounter."
I'm almost speechless because when were you diagnosed?
2018.
Because this is, that was 4 years ago,
I know.
right? However, it's important, right? Because it tells us that this still exists.
Where were you when you were diagnosed?
Actually, I went to the clinic to get tested regularly. It was interesting because they weren't sure, so they thought it was a false positive. I got into the meds, I guess, 1 week after I got the news, and that just made me feel really good and safe, right? That I have the access to that.
When I was first diagnosed, they put me in a study and I had to take meds for so long and then go off the meds for so long, and it really made me sick.
Even some people, they think that, oh, like, you deserve it, like, you got it because you're gay. Like, I've heard those things, right? And
yeah,
it's
that
like,
hurts.
but like, how does that, like, that doesn't make any sense for me.
When you try to cast blame with HIV, it just causes you to spiral. You're never gonna get anywhere because the blame isn't on someone, it's not someone's fault.
Most days I don't think about having HIV now, but in the very beginning, I most certainly did think about it every day. I did.
Hi, I'm Kevin. I'm a HIV specialist.
Do you have any advice for me, or when you meet people that are recently diagnosed?
The first thing I'll say is that the decision to disclose to someone is yours, right? That's your decision to make. And what we know now with U equals U, that if you're undetectable, you can't pass HIV through sexual contact. And so really, talking about and making those decisions around disclosure is whatever you're comfortable with and whatever you feel safe in. So we've got our little magical box here, which apparently has some questions in it.
Does a family doctor have to be knowledgeable about HIV or take on your HIV care?
I think in 2022, you don't need to have a whole lot of knowledge about HIV to be able to be a good physician for someone who is living with HIV. HIV treatment, again, is pretty easy these days, as you know, right? It's easy medications that are usually 1 pill once a day with minimal to no side effects and minimal to no drug interactions. So You know, it doesn't take a lot of expertise to be a family doctor for someone who's living with HIV. If there's one thing you could change right now that you think could be made better within the healthcare system for someone living with HIV, what would that be?
If it's possible, all healthcare providers to have more information, and not only to expect that somebody who is a specialist in HIV is going to treat you well, because I mean, I would like to feel safe even with my family doctor, even if she or he doesn't know anything about HIV.
In the early days there, it would be like, I got a new family doctor and I'd go in and I'd have, I think the one time was a cold. Well, I'm sorry, that's HIV related. You'll have to see your specialist about that. And that happened a lot, so much that I gave up on her.
10 years ago, that happened all the time. Right? Somebody they'd hurt their back lifting a box, and suddenly I'd get a call saying, my family doctor told me to talk to you about that, right? And I still occasionally do have those calls with a family doctor and say, yes, her stubbed toe has nothing to do with her HIV. You know, please treat her stubbed toe, and you know, thank you very much for your help. So, yeah, it doesn't happen as often.
No.
Woo, round of applause.